Welcome to the 2026 Annual Enrollment Presentation for Medicare Retirees. In today's session, we'll cover several important topics to help you prepare for the upcoming year. We'll begin with a look at plan year updates so you'll know what's changing for 2026. Next, we'll review your responsibilities as an enrollee and what actions may be needed on your part. We'll then go over the 2026 plan options available to you and walk through how to enroll to ensure your choices are submitted correctly. In addition, we'll highlight programs designed to support your health, including wellness and disease management resources. We'll also touch on term life insurance coverage and what you need to know about this benefit. And finally, we'll close by sharing contact information so you know exactly where to go if you need help or have questions. Let's get started. Let's go over some important plan changes for 2026. Premiums for the Louisiana Blue, Pelican, and Magnolia plans will increase by 7.75% across all classifications, starting January 1st. The Magnolia Local plan is also expanding to include St. James and Terrebonne parishes, giving more members access to this option. And for the individual Medicare Marketplace with HRA, we're still reviewing bids. Once a vendor is selected, we'll share the details with members. These updates help keep plan options sustainable and accessible for everyone. Here are a couple of important reminders. First, if you wish to remain enrolled in your current health plan for 2026, no action is required. Your coverage will automatically continue. Second, Medicare requires that OGB have your physical street address on file, even if you received your mail at a P.O. box. If you need to update your address, you can call, email, or mail your updated information directly to OGB using your preferred method of contact. Keeping this information current ensures that your coverage and communication will remain uninterrupted. In this section, we'll review your responsibilities and the actions you can take to manage your OGB benefits for the coming year. During annual enrollment, you can switch OGB health plans, adjust or drop term life insurance, and add or remove dependents. You can also discontinue your OGB health coverage, but remember, if you drop it in retirement, you cannot re-enroll later. Review your benefits and make the choices that fit your needs. This section reviews the 2026 health plans to help you make the best choice for your needs during annual enrollment. Medicare Advantage plans can offer several great benefits, including low or no monthly premiums on many plans, extra benefits beyond traditional Medicare coverage, and enrollment available regardless of medical history. However, it is important to do your homework. Plans can vary in coverage, costs, and provider networks, so choose one that best fits your needs and budget. Also be cautious of TV ads, phone calls, and mail promoting Medicare Advantage plans. If you're unsure whether a plan is OGB sponsored, call OGB customer service for guidance. And finally, if you enroll in an OGB sponsored Medicare Advantage plan, you can switch back to another OGB sponsored plan during the next annual enrollment period. OGB offers retirees with Medicare several Medicare Advantage options, including Blue Advantage, Humana, and People's Health. It is important to note that if you choose an OGB-sponsored Medicare Advantage plan, you will retain the option to return to another OGB plan during the next enrollment period. Next, we'll watch videos about each option to learn about their benefits and coverage.
Welcome, OGB members. Here you'll find out more about your local choice of Medicare Advantage, Blue Advantage HMO from the Cross and Shield. You'll learn more about the Medicare Advantage plan from Blue Cross and Blue Shield of Louisiana, created exclusively for you. This video can help guide you as you make your healthcare decisions. However, this video should be considered only a guide. In case of any differences between this video and Blue Cross benefit plan documents, the final plan documents will determine benefits. At Louisiana Blue, we've been protecting Louisianians for 90 years. Now with Blue Advantage, you have a local choice for your Medicare coverage. If you're a retiree and you have Medicare Parts A and B, you'll be eligible for Blue Advantage. Also, spouses who are Medicare eligible can enroll as well. Contact your plan administrator or refer to your plan documents to understand your contribution for this plan. This is an HMO plan, so you must live and get your healthcare services within the state of Louisiana. You'll be covered for emergency services when you're out of the state. Enjoy the ease of medical, hospital, and prescription drug coverage along with dental, vision, hearing, and fitness in one simple plan. Plus, you'll receive a Flex card to use at major retailers or online for over-the-counter health-related products and for the annual eyewear allowance. Now you'll have the simplicity of one member ID card. That can mean no more confusing coordination of benefits. Just put your Medicare card away in a safe place and start using your Blue Advantage member ID. This will be the one card you will need to get your healthcare benefits. Here are some of the highlights of the benefits you'll enjoy with Blue Advantage, such as no-cost preventive visits for your yearly wellness visit, and a $0 copay for vaccines like flu, pneumonia, and shingles. You'll have a $0 copay for outpatient surgery and to see your primary care provider. Urgent care visits have a $10 copay. Also, you can see a specialist in our network for $20 copay and no referral is required. You'll have a maximum out-of-pocket of $2,000 for copays, co-insurance, and other costs for Medicare-covered services. And your ceiling for covered prescription drugs is $2,100. Plus, there's a $0 medical deductible. You'll keep moving with your no-cost fitness membership. Visit a local gym near you or get access to exercise options on your computer or device. The choice is up to you. Choose the safety and convenience of mail order and 3-month fill options for most drugs that we cover. Plus, there's a $0 pharmacy deductible. Blue Advantage is a perfect fit for some retirees, but not all. Before you make your choice, ask yourself these questions. Which doctors, clinics, and hospitals do you visit? Are you prepared to stay in network? Staying in network is very important. As long as you receive care within your network, you will pay less than if you receive care outside of the network. Out-of-network care is covered only in emergencies. What prescription drugs are you taking? Are they covered under this plan? Also, are you getting extra benefits that will help keep you well? Still not certain if your doctors are in the Blue Advantage network or if your drugs will be covered? Call us at 1-833-955-3821 to find out. Does this plan sound right for you? Are you ready to enjoy the added benefits Blue Advantage offers? Refer to your OGB Medicare Advantage Enrollment Guide to find out more. If you would like to enroll in Blue Advantage, contact OGB directly.
Hello OGB members. We are excited to share with you the 2026 Humana Group Medicare Employer Plan, which is available to you through the State of Louisiana Office of Group Benefits. At Humana, we are here to help you make the most of your benefits. Seniors have been at the heart of Humana's care delivery since our founding. Humana is one of the nation's most experienced senior care organizations and most trusted group Medicare Advantage carriers. The Medicare Advantage plans offered through OGB combine Part A, Part B and Part D in one plan administered by Humana. Everything covered under Original Medicare is also covered under the Humana Medicare Advantage plan. Your Medicare Advantage plan also gives you access to wellness, clinical and educational programs at no additional cost. With this plan, you have the ease of one card and one place to call with questions. The Humana plan is an HMO plan. This means you'll need to select a primary care physician or PCP from our broad Louisiana network and work with them to coordinate your care. When necessary, your PCP will provide referrals to other in-network providers. With this plan, you have no co-pays for preventative care, nationwide emergency coverage, and an out-of-pocket maximum for medical expenses each plan year. The HMO plan has set benefits. There is no annual deductible, and the most you will pay out of pocket for eligible medical expenses in a plan year is $2,000. You have a $0 copay for outpatient hospital visits. You have a $50 copay per day for inpatient hospital care, up to the first 10 days. There is a $0 copay for primary care visits and a $10 copay for specialist visits. If you have a medical emergency, you pay a $50 copay for an emergency room visit or a $0 to $10 copay for urgent care. Your plan also includes routine coverage for hearing, vision, and dental. Please refer to your enrollment guide for more information on benefits and services that aren't listed in the grid. The Humana plan includes Part D prescription drug coverage, where each type of prescription is broken out into a category or tier. You will pay different amounts depending on the type of drug, if it's a 30-day supply or a 90-day supply, as well as if you pick up your prescriptions in person from a standard retail pharmacy, or if you choose to use mail-order delivery, like Humana's mail-order pharmacy, CenterWell. There is a cost savings opportunity if you get a 90-day supply through mail order. You pay the listed co-pays for prescription drugs until your out-of-pocket costs reach $2,100. Then, Humana pays 100%. My Humana is a secure online portal with tools to manage your plan. Sign in or activate your account to get safe, immediate access to your plan information. Then, take your Humana Essentials with you wherever you go with the My Humana mobile app. Humana's Smart Summary provides a comprehensive overview of your health benefits and healthcare spending. You'll receive this statement after each month you've had a claim processed. You can also sign into your My Humana account and see your past Smart Summary statements anytime. Choosing a doctor, dentist, vision care provider, or healthcare facility is an important decision. You can use Humana's Find a Doctor tool to search for an in-network provider near you. Telehealth visits allow you to connect with your provider online to get the non-emergency healthcare you need, just like an office visit, but from the comfort and safety of your own home. Humana's specialized programs include dedicated care managers who support those with qualifying conditions along their health journey. After an inpatient discharge from a hospital or skilled nursing facility stay, we provide personal home care to assist with activities of daily living, transportation to follow-up appointments, and meals delivered right to your door. Humana also offers supplement benefits to you at no additional cost. With Go365, Humana makes wellness fun and easy. Complete eligible healthy activities like walking, getting your annual wellness visit, or volunteering to earn rewards to redeem for gift cards. Once you've earned at least $10 in rewards, choose your gift cards in the Go365 Mall. Silver Sneakers is a total health and physical activity program that helps you get fit the way you want by providing access to fitness locations nationwide. Thank you for taking the time to learn more about the Humana HMO plan offered through OGB. Refer to your 2026 enrollment guide to find out more information about how to enroll and what you can expect as a Humana member.
Join People's Health. You'll never be sorry. It has everything you could need or want in a program with Medicare.
Thanks, Peggy. We love hearing this from our plan members because helping our members is our #1 goal. Founded by physicians and medical providers in 1994, People's Health focuses solely on helping people with Medicare, and our success is built on the individual attention we give our members. We are part of the United Healthcare family of plans, and we share a commitment to helping our members live happier, healthier lives. People's Health offers Medicare Advantage plans. These are plans that include more benefits than original Medicare, at no additional cost to our members. Medicare Advantage plans are also known as Medicare Part C. They combine your Part A hospital coverage and your Part B medical coverage for services like doctor's visits and outpatient services into one plan. And most People's Health plans also include Part D prescription drug coverage. When you join a Medicare Advantage plan, you still have Medicare, but your benefits are administered by a Medicare Advantage organization, like People's Health. The Centers for Medicare and Medicaid Services, or CMS, regulates and oversees Medicare Advantage plans. With People's Health, you can enjoy great benefits like primary care doctor visits, urgent care, specialist visits, virtual doctor visits, and many of the preventive care, screenings, and services you use most. Remember, if you travel, you're covered for emergency and urgent care worldwide. And with the United Health Passport program, you can get covered medical care at in-network costs from participating providers across the U.S. You also get those additional benefits not covered by Medicare, like routine vision with an allowance to spend toward eyeglasses or contacts, coverage for hearing aids, comprehensive dental that includes cleanings, exams, dentures, and more, no cost for home-delivered meals after an inpatient hospital stay, and respite care services for members with dementia, including Alzheimer's, plus a fitness benefit that gives you free access to network fitness centers, online fitness classes, and resources to support your brain health. And with People's Health, Part D drug coverage is included, with coverage for all drug tiers through the Medicare Part D coverage gap. It's an all-inclusive package, making it easy and convenient to get the care you need. No need to file claims to get reimbursed. You just present your People's Health ID card. People's Health has one of the largest networks of doctors, nurse practitioners, and specialists in the state, and they're always adding more. Additionally, People's Health Group Medicare also has an out-of-network benefit that lets you see providers that are out of network for certain services, although doing so may incur higher costs. If you'd like to research our plans online, visit peopleshealth.com. We make it easy for you to review plan benefits and look for network doctors and providers. You can also search for prescriptions to see what's covered. We're confident that when you review and compare all the People's Health benefits to the other Medicare options out there, you'll see the advantages of People's Health. And we hope to see you soon as a People's Health Plan member. Thank you for your time and interest in People's Health, your Medicare health team.
Medicare retirees can also select from 4 OGB self-funded plans during the annual enrollment period offered through Louisiana Blue. Those are the Pelican HRA 1000, the Magnolia Local Plus, Magnolia Open Access, and Magnolia Local plans. Now let's watch a few videos about these plans.
The Pelican HRA 1000 health plan has the second lowest monthly premiums of any OGB plan. It offers a health reimbursement account, or HRA. You can use it to pay for health expenses like coinsurance and copays. OGB will fund a set amount in your HRA, about half of your deductible, and use it to pay for your out-of-pocket medical expenses. When you get care, Blue Cross will get the bill and use funds from your HRA to pay your portion. When all the money in your HRA is used up, you will get the bills to pay out of pocket. Any money left over in your HRA at the end of the year stays in your HRA, as long as you remain with the Pelican HRA 1000 plan. This plan has a deductible. Once you reach this amount, OGB will pay 80% of your healthcare costs for in-network providers. It has an out-of-pocket maximum. When you reach it, the plan will pay 100% of your qualified care. This guarantee helps you know you won't pay more than a certain amount for health care during the plan year. Pelican HRA 1000 uses Blue Cross's large, statewide preferred provider network. And you can access the Blue Cross Blue Shield Association national providers. Pelican HRA 1000 also offers out-of-network coverage, which can be helpful if you travel or need highly specialized care. OGB members who are active employees or retirees can choose Pelican HRA 1000.
Plus has the second highest premiums of the OGB health plans. But in exchange for higher upfront cost, it offers set out-of-pocket cost, which could be lower than other plans. In Magnolia Local Plus, many covered services offer co-payments. This will keep what you pay at the doctor's office or other facilities predictable. There are some services that use co-insurance, including diabetes treatment, dialysis, emergency medical services, and durable medical equipment. These services are subject to a small deductible for active members. Once you reach this amount, OGB will pay a large portion of your healthcare costs for in-network providers. There is no deductible for retirees who retired before March 1st, 2015. Magnolia Local Plus has an out-of-pocket maximum. Once you pay this amount in copayments and coinsurance, OGB will pay for 100% of your qualified care. This guarantee helps you know you won't pay more than a certain amount for healthcare during the plan year. Magnolia Local Plus uses Blue Cross's large, statewide preferred provider network. And you can access the Blue Cross Blue Shield Association national providers. Magnolia Local Plus does not offer out-of-network coverage. OGB members who are active employees or retirees with or without Medicare can choose Magnolia Local Plus.
Magnolia Open Access combines moderate deductibles with a nationwide network to make it an attractive plan for members who live out of state or travel regularly. However, premiums for the Magnolia Open Access plan are higher than OGB's other plans. Open Access differs from the other Magnolia plans. In Open Access, you will not pay copays at healthcare provider visits. Instead, once you meet your deductible, you will pay coinsurance for most services. Along with a moderate deductible, Magnolia Open Access offers reasonable out-of-pocket maximums to help keep your out-of-pocket costs lower. When you reach your out-of-pocket maximum, OGB will pay 100% of your qualified care. Magnolia Open Access uses Blue Cross's large, statewide preferred provider directory, the Blue Cross and Blue Shield Association National Providers Directory, and out-of-network coverage. Some OGB members can be eligible for Retiree 100 as part of Magnolia Open Access. Retiree 100 coordinates with Medicare to offer additional coverage for extensive hospital bills and physician charges. Members must have Medicare Parts A and B and very high medical costs. OGB members who are active employees or retirees with or without Medicare can choose Magnolia Open Access.
Magnolia Local combines lower monthly premiums with set out-of-pocket costs to create an exciting option for OGB plan members. We can do this by offering select networks powered by the state's largest healthcare providers, Ochsner Health Network, Christus, Baton Rouge General, and the Baton Rouge Clinic. In the Magnolia Local plan, many covered services offer co-payments. This will keep what you pay at the doctor's office or other facilities predictable. There are some services that use coinsurance, including diabetes treatment, dialysis, emergency medical services, and durable medical equipment. These services are subject to a small deductible for active members. Once you reach this amount, OGB will pay a large portion of your healthcare costs for in-network providers. There is no deductible for retirees who retired before March 1st, 2015. Magnolia Local has a low out-of-pocket maximum. Once you pay this amount in co-payments and co-insurance, OGB will pay for 100% of your qualified care. This guarantee helps you know you won't pay more than a certain amount for healthcare during the plan year. Magnolia Local is available to active employees and retired OGB members who live in the New Orleans and North Shore area, Lafayette and Acadiana, and Caddo and Bossier parishes. It is also available to members in the Baton Rouge area. Magnolia Local does not offer out-of-network coverage.
If you want to learn more about your health plan options, visit the OGB Annual Enrollment website at annualenrollment.groupbenefits.org. There you can explore the plans in detail and get the information you need to make the best choice for you. This section will guide you through the 2026 annual enrollment process, showing the steps you need to take to review and update your OGB benefits. Retired employees can enroll or make changes to their OGB benefits in a few ways. you can use the OGB Annual Enrollment portal, submit an enrollment form, or contact OGB directly, depending on the type of change. For example, if you want to enroll in a new health plan with the same covered dependents as 2025, you can do that through any of these options. If you need to enroll in a health plan with different or new dependents, decrease your life insurance to basic or enhanced basic, or drop your OGB health or life coverage, these actions must be done through OGB directly. Remember, if you discontinue your OGB coverage as a retiree, you won't be able to re-enroll later. If you plan to keep the same covered dependents as in your 2025 plan, you can use the Annual Enrollment portal to select your 2026 health plan. To enroll, simply visit the annualenrollment.groupbenefits.org and follow the links to the Annual Enrollment portal. To access the Annual Enrollment portal, enter your last name, date of birth, the last 4 digits of your Social Security number, and your zip code. Once logged in, verify your contact information, then select your health plan. Review your choices carefully and click Confirm to save your selections and view your confirmation page. If you need to make changes, simply click the Change button. Be sure to print, email, or save a copy of your confirmation page for your records. This section covers wellness and disease management programs offered through OGB, designed to help you stay healthy and manage any chronic conditions effectively. At the Office of Group Benefits, we're committed to helping our members live happier, healthier lives. That's why we offer a variety of wellness and disease management programs. Live Better Louisiana encourages healthy lifestyles with annual wellness checkups and ongoing support. Blue 365 gives you exclusive discounts on fitness gear, gym memberships, nutrition, and more. And with Access Today Health, you can get $0 primary, preventative, and urgent care services with no appointment needed. We'll watch a couple of videos that explain how Live Better Louisiana and Access Today Health work and how they can help you save money. Take advantage of these resources to stay well, because your health is our top priority.
Live Better Louisiana is OGB's game plan for better health. The Office of Group Benefits and Louisiana Blue sponsor LBL at no extra charge to you. In fact, it can save you money. All primary members, active and retired, with OGB Louisiana Blue health plans can get a Catapult Health checkup through Live Better Louisiana. Members of OGB's Medicare Advantage employer plan cannot take part. You can earn a $120 a year credit on your OGB Louisiana Blue premiums for the next plan year if you complete your Catapult Health Clinic checkup, or get a checkup with your primary care doctor and send in a completely filled out PCP form. Clinics are scheduled across the state. You can see them all at timeconfirmed.com/OGB. For more information on Live Better Louisiana, the premium credit, or to download a PCP form, go to lablue.com/OGB, select your health plan, and click Wellness.
Are you a retiree who has health coverage on one of the following OGB health plans? If so, OGB has included an exciting add-on benefit that is 100% paid for by the Office of Group Benefits. This benefit is a VIP clinic membership to any Access Today Health Clinic location. You're already enrolled, which means absolutely no paperwork or application for you to fill out. This unique benefit is an option for retirees that will save you time and money, giving you fast and easy access to basic primary, urgent, and preventative care services. So what are the benefits of your Access Today clinic membership, and how does it work? Access Today members receive VIP treatment. There are no copays, no out-of-pocket expenses, no appointments needed, no long wait times, no insurance hassles, and no paperwork. Now you know what all the buzz is about and why thousands of OGB members give the Access Today program a 98.7% satisfaction score. As a retiree, there are a few important things you need to know about your Access Today clinic membership. First, Your Access Today membership will not interfere with your health insurance or Medicare benefits in any way. Second, you'll want to make sure you keep your regularly scheduled PCP visits. Access Today does not replace your PCP. Third, you'll still have the same options for care that you've always had. This is just another option for care for you, and one that many retirees enjoy. Since 2019, thousands of retirees have made their Access Today clinic membership their first stop for care for unexpected illnesses or accidents. Lastly, in Louisiana alone, there are over 90 Access Today clinic locations, and you can visit any one of those at any time for care. When you're traveling, you can have peace of mind knowing that quality care is close by. There are also clinics in Alabama, Mississippi, and even Texas. We've all experienced the frustration of having to wait days or even weeks for a medical appointment. And you probably have experienced the inconvenience of an unforeseen accident or sickness on a weekend, like a small finger cut while cooking in the kitchen, or coming down with a bad cold and fever. But with your Access Today clinic membership, you have the option to get same-day care at zero cost without needing an appointment. Simply walk in. Retirees have told us that they love not having to wait long to get basic treatment for primary and urgent care conditions, such as respiratory conditions, sinus infections, allergies, colds and coughs, flu and fever, and much more. Services also include general x-rays, some vaccinations, general lab screenings, minor cuts, routine checkups, and additional services. Let's hear what retirees have to say about their Access Today membership.
The care from the clinic was wonderful for my allergies. I didn't even need an appointment, and there was no copay. Plus, I was in and out in about 45 minutes.
When you go to an Access Today clinic, simply show your insurance card and identify yourself as an Access Today member. You can also show them your Access Today membership card. Don't have one? No problem. You can call Access Today Health at 1-800-797-9503 and we'll send you one. Remember, if you don't have a membership card, you can still get service if you need care. Simply identify yourself as an OGB Access Today member when you arrive at the clinic. And one more thing, many retirees go to Access Today clinics to get their Live Better Louisiana annual wellness checkup to receive their $10 monthly premium credit. Remember, this is for retirees only, not their dependents. And that's all the buzz about Access Today. Thank you for your time, and you can thank OGB for providing you with your Access Today clinic membership.
Blue 365, offered through Blue Cross and Blue Shield of Louisiana, gives you access to exclusive discounts to help you live a healthier lifestyle. You can save on fitness gear, gym memberships, nutrition programs, weight management, and other wellness-related products and services. It's a simple way to get more value from your health plan while supporting your personal wellness goals. Check the Blue 365 website for the full list of offers and start taking advantage of the savings today. This section covers term life insurance, explaining your coverage options, how to make changes, and important details to help you protect yourself and your loved ones. Retirees are able to enroll in term life insurance, but it's helpful to understand the coverage you may already have. Your coverage is provided through Prudential Insurance Company of America. There are 3 fully insured plans, and dependent coverage is included. The state pays half of the premium, and you, as the retiree, pay the remainder. This is term life insurance, which provides pure risk protection. There's no cash value. The benefit is paid if death occurs while you're covered. It is designed to protect you and your loved ones, not to build savings. This slide gives an overview of the supplemental term life insurance options, including the Basic, Enhanced Basic, and Basic Plus plans, along with the dependent coverage offered. We won't go through each chart here, but you can find all the detailed information on the OGB website at info.groupbenefits.org. If you're enrolled in term life insurance, your coverage will automatically adjust as you reach certain ages. On January 1st, following your 65th birthday, your coverage will reduce by 25%. Then, on January 1st, following your 70th birthday, it will reduce by another 25%. Premium rates will also adjust to reflect those changes. For updated premium rate sheets and more details, visit the OGB website at info.groupbenefits.org/life-insurance. In this section, we'll go over important contact information for both OGB and our plan vendors. This will help you know where to turn for questions about your benefits, claims, and any other support you may need. Here are the contact details for your OGB health plan vendors. For Louisiana Blue, you can call 1-800-392-4089 or visit www.lablue.com/OGB. For People's Health, call 1-866-877-5403 or visit www.peopleshealth.com. For Blue Advantage, that number is 1-866-508-7145, and you can access the member portal at blueadvantage.louisianablue.com/Medicare/member-portal-home. Silver Script can be reached at 1-888-996-0104 or online at www.caremark.com. And Humana, call 1-877-889-9885 or visit humana.com. Keep this information handy for any questions about your coverage, claims, or member services. For more information about your OGB benefits, visit our websites at info.groupbenefits.org or annualenrollment.groupbenefits.org. You can reach customer service at 1-800-272-8451 and select option 6. We're available Monday through Friday, 8 a.m. to 4:30 p.m. or by email at ogb.customerservice@la.gov. Our office is located in the Claiborne Building in downtown Baton Rouge behind the state capitol. That address is 1201 North 3rd Street, and we are in Suite G159. You can also connect with us on social media. Follow us on X at OGB Louisiana. Visit our YouTube channel or like our Facebook page at State of Louisiana Office of Group Benefits. Thank you for taking the time to review your OGB benefits. We hope this information helps you make informed decisions during annual enrollment. If you have any questions, be sure to visit our websites or contact OGB customer service. Your health and well-being are our top priority.